Well, welcome everyone. My name is John O'Grady. I'm the president of the Franklin County Board of Commissioners. We started these online conversations a few weeks ago, and we wanted to be able to select different topics that are important to you and your family. And today we have the ability to center around a topic that's available during this outbreak with some safety tips and other useful information. We think these are important topics because it's clear how devastating and overwhelming this outbreak has become. We've gone from the state's first coronavirus case being discovered in Ohio on March 9th, and now we've got, as of this morning, 15,169 cases in Ohio, and as of this morning, 690 deaths. In Franklin County, 1,768 cases have been reported with 48 deaths here in Franklin County. And we've had more unemployment claims filed in the first 4 weeks of this outbreak than were filed in 2018 and 2019 combined. So today my guest is Franklin County Public Health Commissioner Joe Mazolla. Joe and his staff have been helping to educate and protect Franklin County residents. They've been doing this for years, but they've been doing it at a breakneck speed and for 24/7 for the last several weeks. And I think it's pretty safe to say that he and his staff have had little time for much else since the middle of March. I want to get right into questions this afternoon, and I know there's a lot of you that have questions for Joe, and I suspect that I'm not alone. I know I have questions for Joe. So if you're new to the series or if you are a frequent guest, either way, you can submit your questions via Facebook Live. Just go ahead and type them in, and we will try to get to them and answer them as we go along. So first, let's start with questions from me at this point. So we're going to go ahead with some questions. So Joe, if you want to go ahead and start with some updated stats or anything that you might have, and I would like for you to also explain what the department does normally and what you've been doing here over the course of the last several weeks. And then also, if you could explain what makes your department different from Columbus Public Health.
Sure. Well, good afternoon, Commissioner O'Grady. Thanks so much for having me this afternoon. I really appreciate the opportunity. First, let me say I want to thank the Board of Commissioners for your continued partnership with our COVID-19 response. This is, as you mentioned, this has certainly been an unprecedented event, and as a health department, it has obviously taken almost exclusively all of our energy and attention over the last 6 to 8 weeks. And our staff have been just remarkable in that response. So I want to thank them and partners like the Board of Commissioners as well, who our community has really stepped up and have just been just tremendous collaborators, and we just can't thank them enough. And so let me just talk a little bit about some of the topics that you just highlighted there. So Franklin County Public Health is a general health district. We serve the villages and townships in Franklin County, as well as 14 local suburban communities. So our health jurisdiction is about 475,000 people, and we provide public health services to those local municipalities and the residents that live there. Columbus Public Health is the other local health department in Franklin County. They provide public health services to the city of Columbus and the city of Worthington. So collectively, we work every day, we partner every day to provide essential public health services to our local community. So we certainly collaborate very closely with Columbus Public Health, and COVID-19 is certainly no exception. So we talk to Columbus every day. And let me just kind of get into a little bit of the background about what our role is with COVID-19. So you mentioned some of the statistics already. As a state and as a county, in our health jurisdiction, we of course are tracking that as well. We have 508 cases of COVID-19 in our health jurisdiction. So again, this is outside of the city of Columbus and Worthington. We have 85 hospitalizations, and we are reporting 18 deaths in our health jurisdiction. So as local health departments, we work every day to respond to this event. One of the things that we do is the investigation and the contact tracing. So of course we work with individuals who are positive, isolating them, and then working to understand who they may have come into contact with, and then asking those individuals to self-quarantine as well. We do a lot of prevention work with respect to getting information out to our residents, just like you said earlier in the introduction, working every day to make sure that our residents understand what COVID-19 is, how to protect themselves, and really how we can continue to inform and educate our residents about COVID-19. And then thirdly, we really are looking very closely at the disease burden itself. And I think we're going to talk a bit more about that as well. Kind of who is most at risk, and really how is COVID-19 really affecting our residents as well. So we are just in my opinion, just kind of in this first phase of the response to the pandemic. And we can talk a bit more about that. But really this first 6 to 8 weeks have been really kind of an urgent response to how quickly the virus was spreading. And we've worked to collaborate with all of our local municipalities, school districts, the county, our university partners, healthcare providers. And so it's really been kind of a 24 hours a day response. And our staff continues to make sure that we are kind of looking forward to really think about how we're going to continue to respond moving forward. So that's kind of the situation as it stands right now, and kind of where Franklin County Public Health has been involved with so far.
So Joe, we know that there's racial disparities with COVID-19. We serve all of Franklin County. We have such a big population here. We have 1.3 million residents, and probably about a quarter of those residents are African American. And we know that there's a racial disparity here. Why is that, and what is it that we're seeing that tells us that there's a racial disparity there? What's the underlying issue there?
Yeah, so COVID-19 really has sort of highlighted the underlying health disparities that our community has been continues to respond to. And so we know that we have health disparities across our county as it relates to hypertension and diabetes, other chronic conditions. And we see a lot of those disparities within the African American community. And what we're seeing now with COVID-19 is that those individuals who have those underlying health conditions are really more at risk for additional complications because of it. So it's kind of like this this exacerbation of these health disparities, and that's why we've been really focused over the last 4 to 6 weeks when we started to see in the data that African Americans, for example, were being hospitalized at twice the rate as our other residents, and we knew that the comorbidities were going to be a significant factor of those who were most at risk. But once we started to see that realization in the data, we've started to take some additional steps in terms of engagement and our communication efforts. But it just really kind of just emphasizes and highlights, why it's so important that as a public health system, we need to continue to work towards that idea around reducing health disparities in our community. That is certainly has been a focus of our community health improvement plan. So as we work to address diabetes and hypertension and obesity and other chronic conditions, our focus at the health department has been focused on social determinants of health, focused on those underlying issues that cause individuals to not have opportunities to have a healthier life, access to care, education, access to employment, transportation. All of those things are kind of centered in our community health improvement plan. And so what we're seeing now with COVID-19 is we're seeing individuals who have those comorbidities. They're, of course, getting exposed to the virus, and then they're having those additional complications. So important for us to continue to really focus our efforts on those who are most at risk. And it's those who have those underlying health conditions, and then of course our residents who are 60 and over as well. We're doing everything that we can to make sure that we are looking at the data. We're publishing that data on our website. Our colleagues at Columbus Public Health have done a fantastic job putting that data out there in a weekly report as well. And so we want to use that data to really inform how we're going to be moving forward to make sure that we're reducing the impact that this disease is having in our community.
This is a great way to, not great way to, this disease shows shines a light on the fact that I'm trying to figure out, back up and choose my words differently, but this disease shines a light on the fact and shines a light on the idea that your zip code shouldn't be a determinant of your healthcare, and shouldn't be a determinant of the type of healthcare that you receive. So there's no question about that. So so let's talk about testing for a minute, if you can. Had a conversation yesterday with folks from the Wexner Medical Center. They were telling me that the folks in their science department were working with some of their other folks in their engineering department, and now they are producing some test kits with some of their what do you call they're producing them, they're computer generating with their printers, with printers now. They're printing some of these test kits, which is fantastic stuff. How easy is it to get test kits now? Is everyone are more people having the opportunity to be tested these days than originally was happening? Will testing be able to benefit employers as we approach May 1st, and we're looking at the possibility of soft openings of businesses? How is testing going, and how do you see testing going?
Yeah, actually, there's some sort of breaking news on that front just this afternoon that I'll talk about from the press conference from Governor DeWine this afternoon. But let me just back up and talk a little bit about the progression of testing, because we know it's been a challenge. You mentioned that Ohio State University has been a part of creating the supplies that are needed for testing. And we've, as a state, as a country, we have struggled with providing testing because of the supplies that are needed. And so we've had to sort of make our own way with this, and I give credit to partners like Ohio State, like the state of Ohio, who have figured out ways that we can make those supplies available to maximize our testing capacity. Our hospitals have testing capacity. Our state health laboratory has testing capacity. Of course, the private sector has testing capacity, but without those supplies, you can't move forward with the test. The state has had some very stringent guidance on testing since this started. They've actually revised that guidance just this afternoon, or excuse me, earlier this week. And so there's been a continued focus to make sure that those who are, again, most at risk are getting tested. And there's a tiered process for that, and we can make that link available perhaps during this conversation. But there's been a nice breakthrough that was just announced earlier today, where the governor has announced some additional testing capability and supplies that through some arrangements that the state of Ohio has been able to make. And that is really going to expand our ability to test across the state of Ohio. They used some numbers this afternoon that by mid-May, we're going to be able to test 22,000 people per day, which is a significant increase in terms of what we're able to test now. So there's really good news on that front, and we're anxious to see how that's going to look here in Franklin County. And so my hope is that obviously we'll continue to implement additional testing here locally to make sure that those who meet those tiering criteria do get referred for testing, because we know without the testing we don't have the data, and we absolutely have to have that as one core component to being able to make informed decisions moving forward as we look to kind of reopen our parts of our community that have been sort of shut down because of where we are with this outbreak. So testing, I think there's a lot of positive good news that we heard today. And because of the partnerships and the organizations like Ohio State and others, we have done our best to make sure that even with limited testing capacity, that we're focused on those most at risk. And I do want to mention one thing, one unique partnership that we've been able to be a part of here locally. National Church Residency put together a program where we're able to work with Medical Reserve Corps volunteers that we work with at the health department and connect them to National Church Residency to go into long-term care facilities and do some rapid swabbing so that we can get those tests turned around very quickly. Obviously, those who live in long-term care facilities are very high risk residents of our community. And so that's a unique partnership that we've been able to be a part of, and making sure that we can get tests to them quickly, get those turned around so that facility can make very quick decisions on if they are experiencing a potential outbreak within that facility. So good news and more encouraging news on the testing front, and we're hopeful that that's going to play out here very soon for us here in Franklin County.
So we have a couple questions from folks on Facebook. The one is in regard to to what extent have efforts been ramped up to process unemployment applications? I don't know that either one of us, Joe, do you have an answer to that question? I know we can probably find that out and put that out on Facebook Live if you don't have an answer. I know I don't have an answer to that question.
Well, I was on a call on Monday with the director of the Ohio Department of Jobs and Family Services. I know that they're working day and night on increasing their system's capacity to turn those applications and move those forward. Other than that, I don't have a lot of good information. But I do know that they've been working real hard on that.
So we'll have our communications folks who are monitoring the conversation here get with our folks from JFS, Franklin County JFS, and see if they can put something on Facebook on the Facebook Live feed about that. So then the next question is, where do employers send their employees to get tested?
So they don't send them anywhere, actually. For employees who potentially may feel like they need to get tested, and I'll just kind of speak generically, an individual should first and foremost, if they feel like they may be at risk for having COVID-19, they should reach out to their healthcare provider first.
They should talk to their doctor or their healthcare provider first, right?
Absolutely. So that conversation needs to happen first. At that point, only then can they potentially move forward in the process. So it all starts with that first consult over the phone with their healthcare provider.
And then decisions go from there as to whether or not testing needs to occur, and your healthcare provider can help you with the decision about that. The test can then potentially happen either at the hospital or the decisions will go from there. Your healthcare provider will know where to send you from there.
That's correct.
Gotcha. Okay, let's move on. Let's talk about face masks. So give us some guidance about face masks, coverings. I mean, we have here, I mean, obviously, as a county commissioner, I have all kinds of information. I've been on calls with you, Joe, every morning. For Joe and I knew each other casually. You know, as the health commissioner and the county commissioner, we talk to each other a handful of times a year. Now, since the middle of March, Joe and I have become intimately aware of each other. We know each other quite well. And I know plenty about face masks and face coverings. And so we have everything from bandanas that we've learned how to fashion into face masks using coffee filters and rubber bands and hair bangers, to the face mask, the cloth or the paper face mask that we've ordered online from Amazon, to you name it. We don't leave the house. We don't leave the I shouldn't say that. We don't leave the driveway. We don't leave our address without face masks. It's a deal we cut with our children. It's a deal we cut here amongst the family. We have 6 here in the house. So, and by the way, I always warn people when we get on these Facebook Lives, you might hear a dog, you might hear any one of my 4 children, you might hear my wife. It happens. We have 6 people here in this house. And so each time we have a Facebook Live, there's a good likelihood that we might get disturbed, but it's okay. It's what happens. We're all dealing with the new normal. But it's a deal that we all cut here, that you don't leave without face masks. You don't go anywhere. You don't go pick up groceries. You don't go to the doctor's office. You don't go to pick up medications. You don't leave without a face mask. But so talk to us about face masks, Joe. Talk to us. I was watching something earlier on one of the news programs. People are wearing them incorrectly. People are using the wrong things. People are, we see it all the time. We go to places where people just don't even have them. So give us the 411 health director style or health commissioner style on face masks and face coverings.
Sure. So this is kind of part of the new normal. Is this idea that we all now have to wear a face covering or a face mask to go to the store, to go to run an errand, sometimes to go to work now. And, it's a learning curve, but it's a necessary part of our new reality. And so I'll talk a little bit about this. And let me take this as a first opportunity to plug our website, because our staff have put amazing resources together on our webpage. And one of those is this guidance around how to use a face mask or a face covering. So I want to compliment our staff and everything that they've done to put this information out there. So when you go to our website, which is myfcph.org, and we can put that in the comments or what have you, click on resources.
It's already there.
Okay, cool. So you go and you click on resources, click on face coverings and masks. You'll have all the guidance that you need in terms of how to make one, how to use one, how to maintain one, and really kind of walk you through why you need to have one now. And so face masks, though, and face coverings do not take the place of social distancing. I want to make sure I say that as well. So we still have to keep that good social distancing, that physical distancing away from one another. So when you go to the store, for example, if you have to take that weekly trip to the grocery store, when you go, you put your face covering over your mouth, but you also want to make sure you maintain that social distancing when you're in the store as well. This is kind of a new thing, and so I think, to your point, Commissioner, folks are forgetting. They're not used to wearing them. It's uncomfortable, but it's an unfortunate reality. And I tell everyone, really no exceptions anymore. If you're going out of the house, put on a face covering. And what I try to do is say, when you see somebody who has that covering on their face, think of them as doing the right thing, not just for themselves, but for you. So it's really not just about taking care of your own health. This is about taking care of all of our community's health. So when you see that person, your first inclination might be, oh, that's kind of strange looking, but really I'm asking our residents to say, wow, that person's taken the necessary steps to protect all of our health and our community. So as I mentioned, lots of great guidance and information on our website about face masks and coverings. And if you need assistance with any of that, there's some resources there to kind of walk you through that. So it's a new reality for us. It's going to be with us for a long time. I need to say that as well. This is not going away. In fact, it's probably going to expand. As we continue to make decisions about how to sort of reopen parts of our society, you're going to see that a kind of a core tenet of that is going to be the use of face covering. So I would say we all need to get used to it. It's going to be here for a while, and we're hoping we're going to continue to provide the information that's needed for our residents so that they can make sure that they're utilizing it and using it effectively.
So let me ask a couple questions, Joe. So tell me about face masks. Tell me some of some of the like face mask do's and don'ts. What's an improper way to wear a face mask or use a face mask? I've seen people, I've seen people do it wrong. I've been I've been places where folks have covered their mouth but not covered their nose, or whatever. So tell me what, tell the viewers what is improper, and in terms of care for these items.
Yeah. So, and again, I may forget a couple of things. So I want to redirect folks to our website, because all the information is right there. But really,
myfcph.org, right?
myfcph.org. You'll see on the scroll there, you'll see COVID-19. You click on COVID-19, and then there's a resources section that you'll see for face coverings and face masks.
Great.
And all that information is right there. But really, there's a couple things that you want to kind of think about when you're putting on your face covering. It should definitely fit snugly, against the side of your face. So you want it to kind of fit snugly over your face. You want it secured with ties or ear loops around your ears. Hopefully, it'll include some multiple layers of fabric. Of course, you don't want to restrict your breathing, so want to allow for some for you to breathe comfortably. And then it should be laundered, without damaging it or really kind of compromising it. So you can put it in the laundry, but make sure that whatever you're using, it doesn't kind of rip or tear or anything like that. So those are some of the kind of the basics, which certainly is sort of common sense. But we want to make sure that your nose and your mouth are all covered under your chin, and then do that comfortably, of course. But all of that is really well laid out on our website. Lots of great pictures and descriptions on how to wear it, how to create one if you need to. Just using things that you have around the house, perhaps, and then how to maintain it as well.
Great. Should we wear gloves, Joe?
So right now, we're not recommending that at this point. Really, the best thing we can do with our hands is wash them. Wash them frequently. That right now is the best public health guidance that we're utilizing. I think it seems so simple sometimes, but really, frequent hand washing, 20 seconds, soap and water. If you think you've washed your hands enough for the day, wash them one more time. Of course, if you don't have soap and water available, hand sanitizer, of course, works as well. But frequent hand washing is right now the best recommendation that we have.
So I was telling somebody yesterday, I wash my hands so much, and I dislike lotion so much that my hands have just begun to crack and open. I have to use Neosporin on my hands because my hands are in such bad shape. So it's a little kind of crazy. Let's see. Let's move on here. So next question. And I don't know if we don't have it at the moment. We don't have anything coming in from Facebook Live. So if you got questions out there on Facebook Live, by all means, send them in. So are there truly patients out there that have tested positive yet have no symptoms? And do we have patients like that here in Franklin County?
So we do. I think one thing, that we continue to learn about this virus as time goes on. What we know now about COVID-19, some things we know now that we didn't know 6, 8, 12 weeks ago, obviously. So we continue to learn more and more about the disease, about how it spreads, and about how it is affecting and plays out with in terms of symptoms as well. So what we're definitely learning is that there is a good percentage of those who are COVID-19 positive who are asymptomatic. And of course, that is concerning from a public health standpoint, because if you're not exhibiting symptoms, chances are you're not going to go and get tested, which is consistent with the guidance that we have. But that, of course, lends itself to further community spread, and of course, the spread of the disease. So we are learning more and more about what that looks like here in the state of Ohio. But it's very apparent that many people who are COVID-19 positive do exhibit minimal symptoms, if any. Most do, but a good percentage are asymptomatic. So we'll continue to keep an eye on how that is looking here in Franklin County. But it's one of those reminders as to why it's so important that we continue those steps in terms of the social distancing, et cetera. So because you just don't know who might be positive and who is not. Symptoms by themselves aren't going to tell us. What we're learning with this disease is that too many people are asymptomatic, and we just need to continue to make sure that we're keeping that separation between ourselves and others.
So what are some of the biggest myths that you've learned about so far with all of this?
Well, that's a great question. I don't know if I have a list for you per se, but I think what we're focused on is when we do hear something that we know is not true, we try to really be as aggressive as possible with kind of putting that myth to rest, so to speak. So I probably don't have a good list for you, but I do know that our communication staff have heard things online, social media, and I think a lot of folks who are just sort of sharing things that they maybe have heard here or there online, and those tend to kind of get out. We are working really hard to make sure that we are being responsive to those myths and making sure that we're getting the right information out there. So I would say to anyone who's listening right now, make sure you're getting your information from a trusted source, whether that's your county health department, your city health department, if you live in Columbus, of course, the state health department, and really make sure that you're taking that information from those trusted sources. So, a lot of folks have varying opinions about COVID-19. They're kind of hearing information, reports, etc. I would say, be careful about that. Make sure that you are going to the proper site for information, and we're doing our best to make sure that we're squashing those myths as quickly as we can.
In today's world, trusted sources are, unusual and valid thing or valuable things. So I got a couple more Facebook questions here. Will Franklin County have stricter restrictions than the rest of the state since we have more cases than a lot of areas? I mean, obviously, we're one of the larger county. We're the largest county in the state. A lot of this, if you look at the numbers, a lot of the smaller counties around the state don't have nearly the numbers that we have. Some of them, like Marion County, because of the correctional facility there, has a gigantic number. But a lot of the smaller counties in Southeast Ohio and Southern Ohio don't have nearly the numbers we do. They simply don't have the population we have. But I guess the question is because of our population and our numbers, will we have stricter regulations than other places?
Yeah, let me answer that a couple different ways. So of course, a lot of this will be driven by Governor DeWine's decisions related to the stay-at-home order. And then, of course, the state health director as well, and some of the decisions that Dr. Acton will make, that will impact us here locally, of course. I can say that, the state is taking a very measured, very careful approach as to how they're going about making those determinations. We just heard that again this afternoon. And I want to, compliment the state. They've been very thoughtful about how and when they feel that the state can open up. And so those decisions are, of course, are coming, and they will affect Franklin County. But here locally, we will have opportunities to make sure that we are working with all of our businesses, all of our whatever affected organizations that are going to be a part of those decisions that the state will make. It's our job to make sure that we're reaching out to all of them to ensure that they have that information, that they're implementing that guidance in an effective way. And so I don't think that it'll look necessarily different because of the size of our county, but it's incumbent upon us to make sure that as a county, we coordinate and we collaborate across systems to ensure that that guidance is reaching where it needs to go, and that we are making sure that it's being carried out effectively and with fidelity. So, it's sort of that we're going to take the general guidance and those decisions at the state level, and then we're going to localize that here in Franklin County to make sure that anyone who might be affected by those decisions are adhering to them, and that we can work to provide that technical assistance and that additional information here locally to make sure that as everything plays out locally, that we do that in a way that protects all of our residents here in Franklin County.
Gotcha. Okay. So now I have somebody on Facebook Live who, this is an interesting question because I have been working with a friend to deal with this issue. Would like to know what is the latest on low oxygen or O2 readings as an early indicator of infection rather than high temperatures. I just was working with a friend to get a pulse ox monitor for her family, who has a family member who is likely a COVID-19 patient, suspected to be a COVID-19 patient. So, is there anything any new information on that?
Yeah, so I don't have any new information on that in front of me, but I'll take that back, and if there's a member of our team who's on this call, we'll take a note of that, and we'll make sure we follow up with that individual who asked that question.
So the pulse ox or pulse oximeter test is the thing they put on the end of your finger when you go in to see the doctor, when they're taking your vitals. They take your temperature, they take your blood pressure, and then they put that little. Matter of fact, we have here, if you can, we have one here at the house because my wife and I are both heart patients. It's this thing that they put on the end of your finger, and they take measure the amount of, it measures the oxygen level in your blood. Correct, Joe? It measures the oxygen level in your blood, and so there is some indication, I guess, that the oxygen level in your blood now is a good indicator for early indicator for whether or not you are if you may have COVID-19. And so that's a good question, and we will try to get you an answer for that. There's more. I have more Facebook Live questions.
Okay.
What's the best way to make sure that groceries and packages coming into the house, groceries, takeout food, any other type of package, something that is delivered from Amazon or from one of the other FedEx or one of the other ground delivery services? How do you ensure that those things coming into the house are safe?
Yeah, that's a great question. Again, part of our new reality. And before I answer it, can we just say thank you to all of the grocery workers, delivery drivers, everybody who's making this this new reality work for everybody else. All of those essential workers who are just doing incredible work to make sure that we can eat every day, that those groceries do get delivered, and packages continue. And so our thanks to all of them for all their work. But really, so what would I would recommend is that, so you receive a delivery at the home, maybe your groceries, maybe whatever else that might be delivered. You want to make sure that when you bring it in, unload those groceries. Make sure that you're washing your hands as you go. Make sure that you're disposing of the packaging right away. If it's on a surface, obviously wipe down that surface right away as well. So it's really just about good proper hygiene. I wouldn't be significantly concerned about grabbing the bag and putting it and then unloading the groceries. Make sure though you're washing your hands as you go. Continual hand washing, keeping those surfaces clean, and then disposing of whatever the packaging that came in, and disposing of that right away.
Great. Sorry, I keep putting things on mute. There's a lot of activity in my house at the moment. All right. I don't know if this maybe you've been in touch with CODA. I had a conversation with Joanna Pickerton from CODA yesterday. The question is, how long will CODA be free, and will parking be reduced for a while. Those are questions for CODA and for parking. I'm assuming they're asking about city traffic and engineering department parking at meters and wherever else. I guess my best answer to those is for the short term, maybe for the foreseeable future. The conversation that I had with Joanna Pinkerton, who runs CODA, as the CEO at CODA, is yes, it's going to be free for a bit longer. How long? I don't think there's an answer to that quite yet. I think we're all still operating under the new norm. But yes, the intention is that we are going to be we're going to stay here. They are, they're in the same type of a difficult situation everybody else is. She has had to do some restructuring at the executive level. There are some folks there that have lost their jobs, but bus drivers have not. She is going to be they're restructuring. Folks, the drivers are going to continue to be paid at a 40-hour a week rate, but maybe not working necessarily those 40 hours because they're trying to keep those drivers safe and employed. So they're just like everybody else. They're operating in a very, very difficult environment. Mm-hmm. Mm-hmm. So tough stuff.
Yeah.
Sorry, go ahead.
Well, I was just gonna say, CODA is another amazing example of what organizations have done to respond. I know they've had to make, as you just talked about, significant changes and adjustments. But I know there's partnerships and there's collaboration with CODA to make sure that residents who use CODA, they have a face covering when they get on the bus. It's those kinds of things that have been so accommodating to make sure that our residents are protected and that they can continue to make sure that they're getting where they need to go. So our thanks to CODA for all that they've been doing to respond to this. And I know it's been a difficult situation for them.
Gotcha. So we got a question here asking if violent or if crime has reduced during the stay-at-home order. I have some information on that. I don't have all the statistics. I don't know, Joe, if you have an answer for that. What I do know is I do know from talking to Dallas Baldwin, I do know that violent crime has reduced. I do know that from talking to Dallas, I do know that domestic violence has increased. I do know that our jail population is dramatically reduced. That has to do with a lot of things. That has to do with a lot of decisions by a lot of people. Judges, that has to do with a lot of decisions by the judges. That has to do with a lot of decisions by the prosecutor, both the county prosecutor, Ron O'Brien, and the city attorney, Zach Klein. That has to do with a lot of work by a lot of folks in the criminal justice system. So there are a lot of things that are going on in that world. But, I'm not exactly, as a county commissioner, the authority on this issue, and we would have to ask other folks like the county sheriff and Chief Quinlan some of those answers, and we can probably get some more information on that for you. I don't know if you have anything you want to add to that.
Well, yeah, definitely not my my area of expertise per se, but I would just maybe speak a little bit, if I could. This pandemic has certainly caused significant stress and anxiety for many of our residents. That sort of plays out differently for different people. We have been we've been wanting to collaborate, and we've really thanked the Adam H. board for all that they're doing, because we know we've seen some additional surges, for example, in overdoses related to opiate use. And I didn't realize until you just said it that we've seen these increases in domestic violence. We need to continue to support those organizations that are responding to those events. And this is something where, we are, as a community, we're really being tested in a lot of different ways. What we need to do is continue to partner and to collaborate, but it's these secondary effects that we're seeing that are really are as important to make sure that we continue to address. And so, organizations like Choices and some of the other programs that are out there are so important that we continue to promote those as resources for our residents who may be experiencing some really difficult challenges here.
Yeah, no, that's for sure. That is for sure. So Joe, before we go too much further, I have more questions that I have that I'd like to ask you, but I also have another Facebook Live question. But before I go too much further, last week, in each of these things, each of these forums that we've talked about the restaurant industry and the impact that this has had on the restaurant industry. Certainly, we can talk to you about that because I know that you guys, in your capacity as the public health director, you guys have oversight and investigatory oversight as well as licensing. Licensing, yeah, I guess that's true. Licensing and inspection, and there are many things that you guys do in the area of restaurants, and so. And you and I have talked on a number of occasions about folks that are not adhering to the shutdown, and so one, I think you told me last week there are, or sometime maybe it was last week, maybe it was earlier this week. Who knows? In the new world that we live in, everybody's losing track of time. Where are we? My dog wants on screen right now because she wants outside back. Because my wife just went outside. Where are we in terms of? I think you told me we had something like 700 complaints of folks, restaurants and bars that are not adhering to the shutdown. Not that all of them were legit complaints or whatever, but one, but then two, give me, because we've been asking everybody this. Last week we had three, or earlier this week we had 3 restaurant owners on talking about life during the shutdown and how it's impacted them and what they're doing. But give me one of your favorite places that you like to go, and give me one of your favorite coffee shops that you like to go. Number one, but then number two, talk a little bit about what it's been like having to talk to these these folks and problems and issues that you've had with some of these folks not wanting to close down.
Well, so you mentioned 750 complaints, and we have received that many across our health jurisdiction. I can't tell you the percentage of those that relate to restaurants per se, but we have responded to all 750 of them. And most of the time when we get a complaint, it'll be from either an employee or from a patron who maybe they see something that just it's not compliant with the whether it's the social distancing or other expectations of that particular business. It could be a manufacturing plant, it could be a restaurant, it could be whatever. So we'll do an over the phone consult. We'll talk to the business owner. If need be, we'll go on site. But it has been, even though that sounds like a high number, and it's taken up quite a bit of our time to follow up, it's been really remarkable. We get really good compliance. Once we find out what's going on, have an opportunity to have that dialogue with that business owner, our local businesses have really done everything that they can, I think, in good faith to really comply with the stay-at-home order in a way that keeps them being able to operate. And so, for us, obviously, if a business is operating under the stay-at-home order, we want to make sure that they're doing so safely. So that's why we've responded, obviously, to every one of these complaints. And if a resident that's watching now does have a concern, they can go to our website, myfcph.org, go on the COVID-19 page, And we have a complaint form on our webpage where you can just fill out a quick little jot form, and that'll go right to our health department, and we'll follow up. But really, specifically to our restaurants and to our licensed facilities, we know how this really has been a significant impact to them. And we hear a lot about many businesses going out of business, not being able to sustain just the carry-out service. And so, our food, one of the things that we did right off the bat, our registered sanitarians, the first couple of weeks, because we pulled them out of the field for their own safety, was they actually spent a lot of time on the phone calling our food service operators and making sure that they knew what the guidance was, understood what that guidance looked like, answer any questions that they may have, not just for that, but if they had to lay people off, how to connect those employees to file for unemployment, things like that. So, we've been working with our operators in a kind of a new capacity moving forward. So, and what was the other part of your question, Commissioner?
If you wanted to, since we get everybody else to do it, if you to plug any particular place that you and your family like so much.
Oh, yeah, I wish my kids were here. I don't know what they would pick per se, but I'm a coffee drinker, so any coffee shop that's that's nearby, that's my favorite place to go.
Gotcha. Okay. So we only have a few minutes left. So if you're on Facebook Live and you want to get in your last question, this would be a good time to do it. So Joe, I have some other questions here. Somebody asked the question: what are other countries that have lower COVID rates doing differently than we're doing here in the United States?
Well, so every country has. Some have been successful, some not so much. And, I can't speak per se to any specific country, but, I think the theme that we tend to hear is those countries that do the most testing are the most successful. And that's just a public health principle that if we have the data, if we can identify and isolate cases quickly, we can mitigate. And so, those countries that have been most successful tend to be the ones who've done the most testing. And then that's why I'm so excited about some of the recent news that we heard this afternoon, and everything that it will be coming regarding expanding of testing here in Ohio. We know that that's one critical part. It's not everything, but it's one critical part to ensuring that we are minimizing the spread and the impact of COVID-19 in our community. We still need to continue with the primary prevention, those core primary prevention efforts that we've already talked about this afternoon. The testing is one, the contact tracing, of course, and then really making sure that we're addressing those disparities as well.
Great. So let me ask, does the agency, the Facebook Live question is, does the Agency on Aging need volunteers? Are they financially struggling to care for the elderly? No. So the agency, the Franklin County Department of Aging is not financially struggling. We are, the agency, one, is a levy agency, so they're supported by levy dollars, number one. Number two, they are, Franklin County is very strong financially. We expect to weather this crisis within our 2020 budget. They are doing, the Department of Aging is a fantastic agency. They do a great job. Do they need volunteers? Reach out to the agency through the Franklin County Commissioner's website. It is Franklin County. It's commissioners at .franklincountyohio.gov. And so you can reach out to the agency through that website, commissioners.franklincountyohio.gov. You can reach out to the agency through them. I don't know if they are currently in need of volunteers or not, but I'm sure they're not going to turn you away. The next question is what is being done to prevent mass evictions that will likely happen in the coming months? And the answer to that question is, again, reach out to the Department of Job and Family Services. They can help you with that answer. Joy Bivens is our director. Go to the same area, the same website, which is, again, commissioners.franklincountyohio.gov. We are working with Commissioner Director Bivens is working on this issue. We are doing all that we can to prevent evictions, and especially we do all that we can to prevent evictions throughout the course of the year. Anyway, we are certainly doing anything we can do now, working on the issue to make sure that due to this particular crisis, that folks aren't being evicted because of this. Sorry, the dog is very active, and Nancy just tried to pull the iPad off the table here. She really wants to get outside. Let's see. We are starting to run up against time here. Joe, let me see if there's any other questions. I think we're about to that time. So do you have anything else, Joe, that you want to add before we close out?
Can I add just maybe two things? You mentioned volunteers. So I was reading something that this week is National Volunteer Week. And so I mentioned earlier, we work with a group called the Medical Reserve Corps. These are both medical and non-medical professionals who volunteer for us in different public health capacities. So if individuals want to volunteer for the health department, they, again, can go on our website and they can sign up to be an MRC volunteer, and we would love to get them engaged. There's plenty of volunteer opportunities that we're looking at with COVID-19. And then, of course, down the road, we always have volunteer opportunities for different exercises and different events that we put on. And so it's a great way for us to connect with our local residents. We have about 1,600 volunteers in that database, and they're just outstanding. So our MRC program is fantastic. And then lastly, I just want to mention that we are one of 12 agencies that are part of the Central Ohio Pathways Hub, which is coordinated by the Healthcare Collaborative of Greater Columbus. And the hub is the agencies that are part of the hub employ community health workers. And so, as you know, Commissioner, community health workers are able to work with our residents to really address a lot of the things that you've been hearing about, these questions that have come up, things like unemployment, housing stability, transportation, access to medical care, addiction issues. So our community health workers, we have 4 of them, can work with residents to address some of those issues that they're facing as a family, as an individual. So again, you can go onto our website, myfcph.org. You'll see right on the home screen the hub, our hub program, and you can either call us or email us, and you can get connected to a community health worker who can assist you with any of those particular challenges that you might be facing within, again, those social service kinds of challenges that we know are continuing to sort of be exacerbated because of the COVID-19 pandemic.
Well, that's great. We appreciate that. We will, if you're looking to volunteer, there you go. There's your opportunity. Franklin County Public Health could use some volunteers. So, well, it's time to wrap up. I want to thank our interpreter, Jamie. Thank you, Jamie. Great job today. So, well, the dog finally got outside. I was getting ready to say I need to let the dog out, but my daughter just let her outside. So you can find a lot of this information online on our website at commissioners.franklincountyohio.gov. And you can also go to Joe's website, which we've focused on several times, at myfcph.org. We're going to continue these commissioners' conversations. We are working to put together one for Tuesday. Hopefully going to do it Tuesday evening. We're trying to arrange to have one with our friends from the local chapter of the NAACP, Nana Watson, and hopefully others. And we'll probably have one on again late next week as well. So we're working to put those together. And you'll be able to find these on Facebook, Twitter, Instagram, or other information from the commissioners on Facebook, Twitter, Instagram, and Nextdoor. Of course, we want to reach as many residents as possible. So if you're talking to friends and neighbors, please tell them that we'll be streaming conversations like these on a regular basis and posting them to YouTube as well. Until next time, I am Commissioner John O'Grady, along with Franklin County Health Commissioner Joe Mazolla. We want to remind you to stay healthy and stay safe. We hope this was very useful. Joe, thanks for being on with me today. And so just remember, everybody, we're all in this together. Stay safe.
Thank you, Commissioner. Take care.
Thank you, Joe.